Well, Edward, we have more people here. Would this be a good time to start?
Mm. Dr. Device, you're on mute, so I couldn't hear you.
Oh, sorry about that. My internet cut out briefly. So
Okay.
I'm back.
Great. All right. Well, Edward, how about if I introduce you and then maybe you can add to my introduction? So,
Oh,
Edward is a very strong supporter and ally to the University of Utah and the Center for Global Surgery, and he's in Pong, Ghana. And Edward, you have an official title with the University of Utah,
yeah.
which I do not know exactly what it is, but um, we're certainly glad to have you here. Maybe you can tell us what your title is and then
Yeah.
proceed with your presentation.
All right. So I serve as the site director for West Africa Center for Global Surgery here at Ensign Global College. And let me take the opportunity to share my screen. Is it visible?
Yes.
Okay. So at Ensign Global, I'm also a faculty member and the medical director as well. I teach research design and methodology. I'm also teaching epidemiology and then also communicable and non-communicable disease control. And the presentation I have for you is titled Center for Global Surgery and Ensign Global in Action. So I'll take the opportunity to give you a brief introduction about Ensign Global University, our vision, and then our activities together with Center for Global Surgery in training, that's surgical training, advocacy, and then research and innovation. You can see here on the slide that we have a cross-sectional picture of students of Ensign Global College when we did an outreach in October last year. For those of you who have not been to Ensign Global, this is how the entrance to Ensign Global College looks like. We have the administration building that is close to where the van is here on the right, my right. And on the left, there's a building which is called the Center for Leadership, Innovation, and Prosperity. It has actually been completed, so it's no longer under construction. One day, I hope you have the opportunity to visit us at Ensign Global University. We are currently the first and only African-based CEPH, which is Council on Education for Public Health, accredited institution worldwide. So that's something unique about us. And we were formerly affiliated with the Kwame Nkrumah University of Science and Technology. Currently, we work in collaboration with the University of Utah and are also a member of the African Association for Public Health Programs. The American Association for Public Health Programs, we celebrated our 10th anniversary sometime last year, around November. And I mentioned we were formerly affiliated with the Kwame Nkrumah University of Science and Technology because currently we are now a fully fledged university and we are on our own. We received, we are no longer under mentorship. In Ghana, when a university is set up, you have to be under mentorship for at least 10 years with an already established university before you can gain your independence. But we are now fully fledged independent university. We received this charter from the president of Ghana in sometime in December last year. And so you can see the pictures showing here. We have the president of the institution, Professor Stephen Alder, and some board members and executives receiving the charter from the president of Ghana. This is our board of directors. We have about 7, which was also got the board chair part, who is Dr. Lynette Kay. And then we have also some prominent persons in Ghana, as well as in the US as part of the board of governors. Our vision at the institution is to be a world-class academic institution built upon the foundations of excellence in public health and service that promotes prosperity. So everything that we are doing is going to be built around public health, excellence in public health, because almost everything worldwide, in fact, revolves around public health. And I wanted to give a brief introduction about the surgical burden worldwide, which we all are aware of, as we are all aware of in Center for Global Surgery. And it will also help me transition into the presentation I'll give you. So we know that about 5 billion people worldwide are without access to safe, timely, and affordable surgical care. And approximately 18 million people die each year as a result of surgically treatable conditions. Access is worst in developing countries where Ghana is in Africa. Most of them are in Africa. And 9 out of 10 people cannot access basic surgical care. So global surgery in itself is a field of science that is focused on addressing disparities in surgical care worldwide, particularly in low and middle income countries where access to safe, timely, and affordable surgical services is limited. And it encompasses clinical practice and public health strategies to improve access to surgery, anesthesia, and obstetric care on a global scale. And that is where Ensign Global comes in, because Center for Global Surgery has an operational site here in West Africa with Ensign Global University, and it leverages on the public health expertise that we have here. And the vision of Center for Global Surgery is what I have shown here, just as a reminder for everyone, where we envision a world where safe, effective, and affordable surgical care is accessible to everyone. We advocate for improved access to surgery worldwide, creative, innovative solutions with measurable impact, and train leaders to solve the most vexing problems in global health. This is a picture of a strategic planning meeting we had with some of our partners here from this part of the world. We came to Utah, and sometime around 2018, 2019, just before the pandemic, had a strategic planning meeting on our operations here in West Africa. And so I'm sure you're familiar with this map. I took it from Dr. Price, which shows where our initiatives at Center for Global Surgery have been worldwide. But here in West Africa, our focus has been on surgical quality initiatives, women's health, particularly cervical and breast cancer, and also minimally invasive surgery. So that is what our focus here has been in West Africa. We have many collaborators and partners in West Africa, which include the Ghana Health Services, Volta River Authority, Cape Coast Teaching Hospital, Tamale Teaching Hospital, Kolebu Teaching Hospital, Ministry of Health of Ghana, Ministry of Health of the Gambia, Konfo Teaching Hospital, Ghana College of Physicians and Surgeons. These are just a few of them. So in terms of surgical training and education, we have 3 main areas where we have been able to work on. We have been able to successfully set up elective clinical rotations for surgeons, and also support research fellowships. And also currently we are trying to set up a pilot MIS site at Cape Coast Teaching Hospital, working on that. Some of the fellows which have worked with us closely at our site here, I've shown their pictures, and I'm sure you are familiar with most of them. Kevin Bagley, Mustafa, Megan Mali, Sarah Sponels, and Usman Sanyang. In terms of advocacy, our focus has been on breast and cervical cancer care awareness creation, and we have been actively working with Ensign Global since 2018 to date. Usually during the month of October, we actively engage communities around us. So we have been going to schools, engaging adolescents, and also marketplaces. You can see here in the picture, a cross-section of our students in the marketplace talking to the market women. We have some of our students standing in between adolescents who going age pupils here. We also have been working with the community health nurses, creating awareness amongst them and helping to train them as well. We also have been working with the Changing Young Minds project, which was under the Gardner Halls project, which was involved in breast and cervical cancer education for school-going children in the Greater Accra region and Central region of Ghana, and with the aim to expand nationwide. in terms of advocacy, we try as much as possible to, and have tried as much as possible to disseminate our findings at West African College of Surgeons. We go there almost every year. Unfortunately, this year we will not be able to go because of where it's located. But we connect with physicians, with surgeons, to see how best we can work with them at this part of the world. There was the Extreme Affordability Conference, which was held in 2018, and also we had the Ghana Cancer Stakeholder Virtual Forum, which we organized virtually to disseminate our findings on the breast and cervical cancer nationwide assessment. It was greatly attended. So here you can see a table, which is a selection of research projects that have been done. We have done almost about 9 projects since I've been with Center for Global Surgery, almost 9 projects in the past, and some which are currently ongoing. And the total sum of the amount of money we have so far managed is about $600,000 US. So we have the nationwide assessment and mapping of breast and cervical cancer services, which we did one in the Gambia and Ghana, a partnership between Center for Global Surgery, Ensign Global University, Ghana Health Services, Ministry of Health. And then also we have been helping to guide in the Ghana Health Women's Health projects in Ghana. We have 3 projects that have been undertaken so far with Kolebu, one in Tamale Teaching Hospital. And then there's also one which is currently ongoing at Ensign Global University. And I'll tell you a bit more about it. We've also had the pleasure of working with Dr. J.D. Nunes on the Ghana Perioperative Metrics project as well. So there's just a cross-section of some of the projects that we did. The selected research outputs, we have got a lot of them, but I just put in a few here so you can see what we have churned out over the time in prominent journals like the BMJ Open, BMC Health Services, and also +1. We have surveying and mapping of breast and cervical cancer services in Ghana, availability and geographic access to hospital-based cancer diagnostic services, amongst many others. Currently, I'm working on 3 manuscripts, which are implementation science focused. And I'm working together with people at Johns Hopkins University because I'm doing a concentration in implementation science there. So we are looking at a scoping review on the integration of breast and cervical cancer services, which are also known as evidence-based interventions, as an implementation strategy to enhance implementation, service, or population outcomes within the context of Sub-Saharan Africa. The other one has to do with assessing the penetration of cervical cancer service EBIs within the hospital facility systems in Ghana and their geographic accessibility. And the third is evaluating the implementation of breast and cervical cancer service evidence-based interventions relative to the National Cancer Control Strategy and exploring opportunities for integration of both cancer services, that is screening and diagnosis, at hospital facilities in Ghana. So those outputs will be coming out very soon in the form of publications. So I'd like to focus my talk on a research innovation which resulted from the Gardner Hall seed grants, and it's called the development of a real-time interface showing availability of breast and cervical cancer services in Ghana. With the background, I'll tell you about the background of the study, how it started, the goal and specific objectives, methodology, expected outcomes, and then the core team and stakeholders. We all know that cancer is the leading cause of death amongst Ghanaian women. Breast cancers are estimated to have about 4,482 new cases yearly, and then about 2,000 deaths occurring. And then cervical cancer is the second leading cause of death. Approximately 2,700 women are diagnosed, and then 1,600 dying annually in Ghana. The management of cancer disease is a growing public health challenge here at this part of the world. And the 5-year survival for breast cancer is estimated at 39%, whilst in developed countries it's around 90%. Just because people most of the time think they are going to places where they are getting the best service, but in other words, they are on the contrary, they are being mismanaged. The striking disparity in patient survival rates could also be due to socioeconomic reasons, cultural reasons, geographic limitations, combined with later stages of presentation, and the limited navigability to patients across the healthcare system, and limited access to appropriate services. So currently, there's no known nationally integrated data system which exists to audit hospital capabilities for their self-reference, and also for comparison and alignment with Ghana's national priorities and to international standards such as the NCCN. Whilst independent verification of these capabilities is possible, such efforts are time-intensive and expensive to maintain. So our current project advances on the previous project, which we did on nationwide assessment and mapping of breast and cervical cancer services. And this project is a collaborative undertaking between the University of Utah, Ensign Global College, and Ghana Ministry of Health Facilities Regulatory Agency to develop health infrastructure systems in Ghana. It looks at exploring the possibility that regular analyzed data collection on cancer-focused services serves the public good and anchors data products for stakeholders. With the previous study that we did, it took place in 2020 to 2021. It was a mixture of primary data and secondary data, and we developed survey tools using the WHO pipes, and then also the situational assessment readiness as well. There's a survey like that in the WHO. And so the results that came out of the study we did in 2020-2021, I'll just give you a summary. We had to undergo 6 in-country time-consuming and cost-incurring ethical clearances. We had 95% hospitals participating, and we also conducted a webinar to disseminate results to stakeholders, the virtual webinar I talked about. And we have so far done a lot of publications in various journals with respect to that. So here is a GIS map of some of the outputs with regards to breast and cervical cancer from the project. So for this current project that I'm talking about, the real-time interface, the goal is to develop a real-time interface, I'll be saying RTIF in short, to show the availability of breast and cervical cancer services at hospital facilities in Ghana. We have 5 specific objectives, and the first is to perform a contextual analysis of the RTIF in the Ghanaian setting. The second is to conduct a needs assessment. Third, execute a feasibility assessment. And then the fourth is create a prototype real-time interface website. And the fifth will be technically assess the functionality of the RTIF and then further scale up nationwide. For those of you who are not familiar with Ghana, this is how Ghana looks like. We used to have 10 regions. Now we have 16 administrative regions and 216 sub-districts. The research has a foundation on the consolidated framework for implementation research, which has 5 domains. It looks at the intervention, outer setting, inner setting, individual, and then the processes. I will not go into detail into that because it's very technical. So all we need to understand is that we have a framework here, which I am showing, and we got our questionnaires based on the framework. We modified the questionnaires to be able to get our outputs. We used an exploratory qualitative study design and purposefully selected individuals to answer the question. And we also went on to do snowballing. So we looked at key opinion leaders who had functional roles which are relevant in the Ghanaian system to the study objectives. The participants were broadly categorized as policymakers and implementers, healthcare managers and practitioners, cancer patients and survivors, and also non-governmental stakeholders. So there are 4 categories. And the origin of the respondents, we had people from the Eastern Health Association of Ghana, WHO, and Clinton Health Access Initiative, World Bank, USAID, Kolebu Teaching Hospital, Path, JPIGO, Roche, amongst others. So the fourth objective, which is the creation of the prototype real-time interface, involves the use of a REDCap-based database for prototyping, and it leverages an instance at the University of Utah, and it shall be merged with the Health Facilities Regulatory Agency online health systems. So we'll be able to look at the service availability and see the types of screening, diagnosis, and treatments available in Ghana when it is integrated into their systems. The fifth objective is to evaluate the technical functionality of the RTIF and scale up nationwide. And we initially looked at getting our 40 respondents, but now we have 39 respondents as in individual in-depth interviews. So we have collected the data, and we have done the first phase of the analysis. The second phase of the analysis looks at trying to apply the themes to the CFIR framework. So that is where we are at right now. But for the real-time interface, we have actually developed the prototype, and we are polishing it up. But pending some other administrative documents that have to be gotten, and then will be all fully set up. So the expected outcomes of the project that we have, which is not going to end anytime soon, because we are looking at something that would evolve, and through implementation science approaches becomes better and better over time. Our expected outcomes is to be able to create a relevant platform that will evolve to serve the needs of patients, healthcare practitioners, policymakers, and other related stakeholders, such as governmental and non-governmental NGOs. And so patients can just go onto the website and they will see where the services are that are close to them. They want to go and do a pap smear. Is there a pap smear that was available at Hospital A in January? Is it still available? If it's not available, then they don't need to spend money to go there. Or if the mammogram is broken down, they don't need to spend their time and money for transportation going there to seek services. It would also help the government to be able to track the trends and patterns in service availabilities. Another expected outcome is to generate good data for strategic and directional insight into the advancement of cancer control by pharmaceutical and medical technology companies. So they'll be able to know which devices, which equipment need to be at certain locations in the country, because you'll be able to identify the gaps. It will serve as an aid tool for the regulation and standardization of cancer treatment and referral pathways in Ghana. Currently, like I mentioned earlier on, people are going to various places or health facilities. They think they are getting the best care or the standard care, but not knowing they are being mismanaged. So this kind of helps people to know facilities that are approved by Health Facilities Regulatory Agency for managing cancers. It in some way also helps to reduce the delayed stage of presentation. But sometimes in our part of the world, delayed stage of presentation is due to some of these these scenarios where patients are going to places they think they are getting the best care, meanwhile they are not, and then later on they realize that they are being scammed. Let me see. So it can also serve as a model, and we hope that it will serve as a model for the improvement of cancer care services in Africa. And then we hope that it will extend beyond breast and cervical cancer services to other cancer services in general, as well as all other kinds of healthcare services. So the core project team, as I mentioned, is Ensign Global University faculty, working in collaboration with the Health Facilities Regulatory Agency of Ghana, Johns Hopkins University, University of Utah. The strength in this project is the fact that it uses a stakeholder participatory-based approach to build the interface. These are my references. And I would like to acknowledge the Center for Global Surgery, University of Utah, Ensign Global University, Health Facilities Regulatory Agency, Ghana Health Services, Ministry of Health, for their strong support. I also would like to acknowledge all the other individuals listed on this slide. Thank you very much. I'm ready to take any questions.
Great. Well, Edward, thank you very much. That was very interesting. So when the Ensign Global is a new name to me.
Yes, so
Is that always been the name of the school, or?
no. So initially it used to be Ensign College of Public Health. That's when it started in 2014. But then somewhere around 2021, I think so, roughly around that time, the name changed to Ensign Global College. And just because we want to reflect our global focus, not just and do other programs like business, MBA, which are also, and then related to also public health in a way. So, and also show up global reach and focus. So they changed from Ensign College of Public Health to Ensign Global. And currently we are Ensign Global University.
Excellent. So in your slides, you mentioned new breast cancer cases each year in Ghana's 4,482. I'm guessing there are a lot more, but they may never seek medical care.
Exactly. Exactly. So I took these statistics from literature that I saw, but it has been recognized that the number of cases that are being seen are undercounted just because of surveillance systems. And currently, we know that only true functional registry in Ghana is at the Kumasi Cancer Registry. We also have one which is at Kolebu, but it's not as strong as the one in Kumasi. Yeah, so the cases may be more.
Yeah, I think in the US it's 1 out of 8 or 1 out of 9 women will be diagnosed with breast cancer. Maybe that's over a lifetime. So in Ghana has 25 million people.
We are
So
currently
maybe
31 million.
yeah, I was just trying to quickly calculate the numbers, but I would guess 4,000 cases a year is probably way below what is actually developing. But anyway, I mean, good to try. And you had mentioned a surgery rotation.
Yeah.
Is that I know there's a hospital near you.
Yes.
Is that where the work is, where the surgery rotation would be?
Is
So
that the hospital?
that's the Volta River Authority.
Yeah.
So we actually set up a rotation to with the help of Dr. Grace Ayensi. She's also Assistant Site Director at Cape Coast Teaching Hospital. That was our very first clinical rotation we set up for Kevin Bagley. We put together the how much to cost and everything. We had a preceptor who was ready to accept fellows. Then later on, the COVID-19 came. So everything had to shift. So that was a formal one. The one that we did with the VRA was Mustafa. He came along and he wanted to understudy a physician at VRA. So we did the arrangement for him. We had the opportunity to understudy him, but it was not as formal as the one we had with Cape Coast. But for the one we had with Cape Coast, we can still rejuvenate it anytime.
Excellent. So, and how many other groups in Ghana would be doing sort of public health research like this? Are you the only one?
I think related to global surgery.
Yeah, or are there other groups or people that would be doing something,
Okay. So
I mean, pediatric related or infectious disease related?
there definitely are other groups from um other institutions in Ghana who are affiliated with other organizations in the UK, in the US, in Europe doing other work. I think that was one of the things I had talked to Dr. Pais that we wanted to do, but somehow we have not been able to do it because of we had a lot of things doing. So it's something about doing an assessment of the landscape, getting one of our fellows to look at the global surgery initiatives within Ghana. Currently, I am aware of one between the UK and Dr. Tebiri in the north, and it is strongly global surgery focused. Dr. Tebiri had reached out to me some time back for us to consider how best we can align and work together. But it is yet to take place. That meeting is yet to take place. Yeah. So those are the ones I'm aware of. It's just one for now.
Right. So, Edward, I asked this out of ignorance. I should know better, but how does the Center for Global Surgery at Utah sort of relate to your research? So if the Center for Global Surgery did not exist, would you still be doing this, doing it just as well, not doing it at all?
So yeah, so that's a good question. So my work here at Ensign Global University has got three areas, which is teaching, service, and then research. So part of my FTE, I assign and align with Center for Global Surgery. And I try to leverage on Ensign's public health expertise, meaning that I try to align the research that I do with Center for Global Surgery such that it plugs into what Ensign Global will do so that we amplify each other. Ensign Global College didn't have a focus on breast and cervical cancer. But then, because I have a medical background and also Center for Global Surgery, we identified that we wanted to help bridge the gap in cancer care in Ghana. I am able to leverage on both sides to amplify, to get results. I don't know whether I'm answering your question.
Yes, that's good.
So yeah, basically that is it. But then I would say that Center for Global Surgery has been a strength in making things happen.
Yeah, great. Does anyone else have any questions for Edward?
Yeah, I do. So I know that there are the initiatives for breast and cervical cancer. There are some things happening for pediatrics within the West African College of Surgeons. And Ghana actually is likely to become one of the centers, one of the very first training sites for pediatric urology Currently,
Mhm.
in sub-Saharan Africa, there are no training sites at all. So people who perform pediatric urology are either general urologists or pediatric surgeons, but there are gaps in each training path, and the kids fall into that gap. But there are people, and Ghana probably has one of the largest communities of trained people. And Nigeria is the second in Anglophone West Africa. The WACS is planning to certify 3 programs,
Mhm.
2 in Anglophone and 1 in Francophone West Africa. And the Anglophone one, I mean, the Ghanaian one will probably be at Korle-Bu. But there will be, I think, 4 fellowship-trained Ghanaian pediatric urologists when this comes to be, with the intent to train more and serve that whole country and region for training. What there has not been is really a public health assessment of need. And so that's when I mentioned that Mawenyo is now at Toronto Sick Kids. She is studying research methodology. So she will have, that a Ghanaian background and intent to go back with that methodology. And I'm wondering how you think the Center for Global Surgery, as the West African lead for this, how can we participate most effectively in demonstrating need and doing, for example, heat maps of need versus capacity of the sort that have already been done for breast and cervical cancer?
Okay. It's kind of interesting. It seems as if the question you're asking me, I've had a deja vu before. Like, you haven't asked me this question before. So I am envisioning that the real-time interface, if it goes on well, no administrative holdbacks and everything, if it's able to really set up very well, using the breast and cervical cancer services as a footstone, it would now give opportunity to expand service, expand our ability to look at service availability for other service, other specialties, other conditions nationwide, and who has the ability to manage such cases in terms of hospital facilities and the other lower level facilities. Truly, the Health Facilities Regulatory Agency, which is the regulatory authority for managing healthcare in Ghana, and which is the organization we are working with, they are very enthusiastic about this real-time interface platform. And they are even pushing stronger than I am. So they also envision that it could cover all other areas in healthcare. So I can foresee that we can put this in as a plugin, and that's all facilities, healthcare facilities in Ghana would answer, and it would give an assessment of the capabilities for managing pediatric urology cases nationwide. If that is what is that what you wanted?
Yes, and the reason why I ask that is that if we go condition by condition, so for example, if you were to ask about hypospadias or, pick your other condition, that is not an effective way to really holistically look at provision of service.
Mm.
It's a lot more effective to look, I think, at workforce, training and capability versus population, and extrapolate what we already know about the, prevalence of these diseases.
Mm.
If we know how many pediatric surgeons are where, and how many urologists, and who has experience doing this kind of work. So if that base of information is already collected somewhere, then that can streamline the plans for training and also for outreach.
Yeah.
So, as people are learning where to go and who to do. I do know that Moeño has done some of this, but I think that the momentum is building, and so that people don't duplicate efforts, would be nice to find out what's already in place in terms of structure for doing these kinds of studies. And have it be synergistic rather than parallel.
Yeah. Yeah. So, yeah, I agree with you. So our survey for breast and cervical cancer services also looked at personnel trained to be able to provide certain services. So in that regard, potentially, we could look at pediatric surgeon availability at certain facilities to also do certain procedures. The real-time interface is going to be structured such that it can be able to, and I don't know how soon it will be able to materialize in that way, but we are working towards it, to be able to tell population densities as well, so that you can see within a particular area in Ghana, what is the population density, what is the target age groups or gender, and the facility services, healthcare services, specialties that are available to serve the population. In that way, we're able to look at equity in distribution. We're able to look at where the gaps are nationwide. In that way, we're able to know if we want to do, let's say, a training, where will be the most efficient focal points for greatest impact. So these are some of the things that we are looking at, and hopefully it is able to run with speed in terms of getting to where we want to go.
Yeah, I mean, that's really exciting. Is there documentation of that whole process?
So
You
currently,
could share it with us, or website,
I
or
think,
anything.
okay, oh sure, let me show you the website now we are developing. Hold on, let me just look for it first before I share. It's something we are building gradually, and we don't have all the funds. It started with CTS Seed Grant Fund. So on the side, we are going to be able to show where the gaps are and what we need in order to achieve certain targets. I'm hoping that we'll be able to even put some of our publications there and show potential areas for future publication, research by people who want to do research, etc. Just a minute.
Can I ask you both a question, Edward, while you're looking? And what I'm going to ask sort of assumes that the surgeons and the doctors are 100% busy.
Mhm.
So if if you identify a need for more breast or cervical cancer treatment or a need for pediatric urology, but there aren't more doctors trained. Um, and Catherine, I was thinking sort of from a urology standpoint, if more pediatric urology care is offered, does that mean that less adult urology care is going to be offered? Sort of figuring someone switches from adult to pediatric, and in the end, is that a good trade-off? Or
Okay, yeah, so
would this
Dr.
stimulate the country to train more doctors?
Rocco, so I think I have a response for you. So now this is a question you have generated. It is something
Oh,
that's
wow.
as part of the ideas I have for the website to be to have like um, a repository of possible research questions that should be done or research objectives. So the question that you have just asked could be something that could be put there, and anyone who wants to find out what would be the best way in terms of should there be more pediatricians going into pediatric urology, or should there be some kind of efficient referral pathway, or should we have some outreaches that are done every year and all these things. Someone who is doing a PhD or an MPH can take that up as a research topic. The person now knows which facilities to go to. The person has got the contacts of Ghana College and physicians and surgeons. The person can actually do a research on it and come out with evidence. And then that evidence, when published, will now be put back into the system so that people can see. And if there are funding agencies, or there are not only funding agencies, but technocrats who can help make it happen, then it kind of bridges the gap. So we are always working with evidence. The other thing is that even as people do this research and show the evidence, they are always going to come up with recommendations for other research that has to be done and to always make things better. So I am looking at the research, the website being a place where it combines implementation science, which is the study of the methods or techniques used to enhance evidence-based practice in settings. So it's going to use that approach and at the same time use entrepreneurship approach as well as use research approach to make things happen. That is how I'm envisioning the whole thing. I hope I've answered it somehow.
Yes.
Yeah, this is beautiful. This is
Yeah.
really a beautiful platform,
Yeah.
especially if it can be expanded to other kinds of clinical problems, surgical problems. You know, it's an area of interest of different people in our Center for Global Surgery, you know, based in Utah. But since we work in not just Ghana, but in other African countries as well, that this tool could be replicated in many places if it's robust. You know, I mean, this could be also used in other countries, and if Ghana becomes a teaching center for the region, it will be useful to people, you know, around the region. So I think this is really exciting, Edward. It's beautiful.
Yeah, so this is still undergoing construction. So let me go to the About page as well. Our mission, supported by Ensign Global College and in collaboration with Health Facilities Regulatory Agency, we are a research-driven initiative focused on enhancing healthcare accessibility in Ghana, starting with real-time visibility into breast and cervical cancer services. Our mission is to empower individuals, healthcare providers, and policymakers with reliable, up-to-date information on service availability. And by bridging gaps in critical services, health services, we aim to foster proactive healthcare decisions and save lives. Somewhere in there, we have written that we are just starting with breast and cervical cancer service. That's our focus. It's on breast and cervical cancer services. Our broader vision is to continue research in scalable solutions that will improve accessibility for various essential healthcare services like the one you mentioned. Yeah, so these are just placeholder pictures we put in there. Service availability, you see, we are still working on it. We want to be able to show a real-time service dashboard, and then you also be able to see the dynamic data dashboard. The dynamic data dashboard will give us the opportunity to see, health service distribution and availability changes with time. So if someone is looking at it right now on 22nd of January 2025, how did it look like 2 years ago? How did it look like a year ago, 3 years ago? And we plan to also incorporate machine learning and other things into it so that we are able to use AI to make projections and forecasts and to be able to help us make good decisions as where next government or other stakeholders, humanitarians, would invest their time and their resources. So here we have resources. It also has to know research publications that have been done, data statistics, educational materials, funding and grant opportunities as well. So here we are able to even advertise grant opportunities that are available for specific research, like the one that we all identified right now. And then people can apply for it and the results will be shown. Yeah, so getting involved, people can volunteer. Fellows from the Center for Global Research or other places in the US can volunteer. Research assistant, community outreach volunteer, funding and donations can also be put here. People can share their stories as well. So basically, then we have our contacts as well. General inquiries, media inquiries, research collaboration, feedback and suggestions. We have a logo. I'll show you the logo.
So Edward, could you guess if you were going to do that for urology in all of Ghana, and you had one person to do it, how long would it take one person to map out all of Ghana for urology care?
Okay, so what is happening is we are working together with Health Facilities Regulatory Agency, which is an agency. So we develop the questionnaires or whatever is needed with a scientific approach, and then find out how best to get hospitals to respond. We'll give it to Health Facilities Regulatory Agency, and they will share it with all hospitals or health facilities that are recognized by them to respond electronically. And then they will respond, and then the responses will now be quality checked by Health Facilities Regulatory Agency. And then it will now be displayed for everyone to see. So then we'll have it such that maybe on a quarterly basis, facilities are supposed to confirm or review the information they shared. So it's not a one-person job. As of now, this work is still ongoing, so I cannot provide estimates to this. I do not know how it's going to end, but the thing is, I'm documenting whatever we are doing, and if I get stuck anywhere, I'm going to document it and let the whole world know that this is why I got stuck, and this is why I couldn't move on. And I need resources, I need help. Who can help? Something like that. And let's see how it goes.
Yeah, it's a
So
great
that's
project.
the intended logo for now. The team have been meeting we have a technical group meeting every time we'll be meeting. So this is the world. You can see a stethoscope around the world. We are listening to the world, the heartbeat of the world. and also making sure that care is being given. It's we are giving care and health service to everyone, making it accessible to everyone. That's what the arms represents, and holding it delicately. So our project is the Health for All project.
Excellent. Yeah. All right. Catherine, any other thoughts? We're at the
No,
end of
this
our
is a
hour.
great presentation. Thank you so much, Edward.
You're welcome. Yeah. I remember Dr. Layen, who is on the call as well. I had a conversation with him when I came to University of Utah, and there was a similar discussion about colonoscopy as well. So the aim is to expand to every kind of healthcare service that is available, and what are the gaps in Ghana. And I think most of the time now, to our healthcare policymakers are making they're making decisions that may not be sometimes comprehensively equitable to everyone or impactful, because they lack the comprehensive data at our part of the world. So this kind of gives a foundation for being able to move resources where they need to be put. Maybe the solution may not be just building more hospitals. We don't need more hospitals. Maybe the solution may be how to get the services, the relevant services to particular places. Well, or maybe we need more hospitals. So this could help in that direction.
Great.
Thank you.
Thank you. All right. Well, thank you, everyone. And Edward, especially thank you to you. That was very good, very interesting. I learned a lot.
All right. So I'm looking forward to collaborating more with you.
Yes, well, that'll be great. Do you have a trip to the US planned?
So my intention is that I have to be able to connect with you in person almost every year. So I'm seeing how best to make it happen this year as well. Yeah, but I have a potential trip planned. So let's see how it goes.
Yeah, come when the weather's warm.
No, I will.
It's pretty cold here now. Great. All right. Well, Edward, thank you very much. We appreciate the talk and appreciate all your involvement with the Center for Global Surgery.
You're welcome.
Great. Okay. Well, thanks. Have a good day. Good evening.